not a big presentation. You have mentioned most of that, but for writing the answer, I think this may be in a more concise manner.
Okay.
So the concern for anesthesiologists during perioperative period is the altered baseline physiology due to the practice of polypharmacy by surgical patients and the associated comorbidities that can greatly increase the mortality or morbidity. The clinical consequences of complementary and alternate medicine. It is an acronym CAM by short form, and its complication can affect any organ system and may lead to myocardial infarction, stroke, bleeding, higher anesthetic consumption, delayed recovery from anesthesia, respiratory complications, renal disturbances, or nullification of the therapeutic effect of other medications, and even transplant rejection also can happen. So patients coming for renal transplant, sometimes their previous herbal treatment or something may cause, even if your tissue matching everything is normal, that drug may be the cause for transplant rejection. And the implications of CAM could be due to their direct action, pharmacodynamic effect, and pharmacokinetic effect, which you mentioned correctly. And there are 5 major categories of complementary and alternative medicines. One is alternative medical systems like homeopathy, naturopathy, or traditional Chinese medicine and Ayurveda. Then mind-body interventions like meditation, prayer, art, music, and dance therapy. Biologically based treatment like herbal medicines and dietary supplements. And manipulative and body-based treatments like therapeutic manipulation and osteoarthropathic manipulation and massage, and energy therapies like acupuncture, electromagnetic fields, and Reiki and Qigong. So among these 5 varieties or major categories of complementary and alternative medicine, I have made these 2 in different color, that is alternative medical systems and biologically based treatment, because they are the ones which are going to be directly involved in these 3 things: direct action or pharmacodynamic effect or pharmacokinetic effect. So of the above 5 categories, 1 and 3 have implications to anesthesia, but the other things may be helpful to anesthesia. Category 5 is useful as an adjuvant therapy in some conditions like vomiting and pain. So the energy therapies, acupuncture, electromagnetic fields, Reiki, all these things may be used as an adjuvant for our therapy, whereas alternate medical systems and biological based treatment, they are the ones which can interact and produce complications to our system of medicine. So commonly used herbal medicines and their concerns are given in this beautiful tabular column in the book. I have taken a photo right direct from the book, and you can go through all that, and Pavitra has explained all these things, and these are the medicines which have been listed here: echinacea, ginkgo biloba, garlic, ginseng, ephedra. Ephedra, the word itself is like ephedrine, so it causes tachycardia and hypertension. And this St. John's wort is asked sometimes as a short note question. This is a drug which has been mainly used to treat depression. Okay, so you can find St. John's wort, amber, goat, seed, hardy. This is a combination. It is something like a concoction. So inhibits neurotransmitter reuptake and MO inhibition, unlikely. Induction of cytochrome P450 enzymes affects cyclosporine, warfarin, steroids, and protease inhibitors, and may affect benzodiazepine. And this drug sometimes may be the cause for transplant rejection also, and it causes delayed emergence as well as serum digoxin level. So if it is asked as a short note question, all you have to write only these points. 5 days of abstinence is important, and what is it used for mainly is the answer that you have to ask. And These are the other medications which are given, and this Valerian sounds similar to the Valium, which is a benzodiazepine. So you can remember the actions by remembering these names. And non-herbal dietary supplements like chondroitin sulfate, minor anticoagulant, and creatine, which is used as a energy supplement, can cause renal dysfunction. And exogenous melatonin can prevent and treat post-op delirium. So some of them are useful also. So this is what you have to remember with regard to this. I think there is not much to add to that. So if you can remember all the 9 names and their actions and their concerns and when to discontinue, that will be good enough. And all the other types of treatment, what she mentioned about, and music therapy. With regard to music therapy, many a times patients who undergo surgeries like cataract or all local anesthetic agents, usually they prefer to hear a music. The surgeons or the theater people usually ask them, do you want a do you like any music? Shall we play something? You want some devotional songs, or you like Carnatic music? And that will help to divert the attention of the patient and reduce their anxiety. So definitely that is a plus point in using them. So whatever answer she has prepared is quite good enough for a few questions or even a short note, whatever the way the questions are asked. But add these 2 points that this topic becomes important because chronic ailment patients coming for surgery, they usually have a trial of other complementary and alternative medicines, and it is a very important duty on the part of the anesthetist to ask whether the patient is using any other herbal or other biological drugs other than allopathy, and document it in their preoperative evaluation is very, very important. Okay, so that is all for this. Any questions or any doubts you want to ask?